I'm here today not to dwell on a lot of the issues that we've talked about with rural transportation. We've talked about already some of the issues with funding, a lot of the issues with a lack of resources, and we all know the challenge that rural communities face when it comes to providing cost-effective and sustainable rural transportation to meet the various needs of our communities. We've also talked a lot about various solutions that are in place. We've seen 10 different case studies that was presented by Lisa about different ways that we can either work together or develop some sort of structure or framework where we can find solutions that meets the various needs of our communities. And each community is going to be different. There's not one model that we can say is going to be just as effective in one community as it is in another, because every community has its own politics, it has its own needs, it has its own resources. So there's not one solution we're going to be talking about here. What we're going to be talking about here is a potential framework that you can utilize to assess within your own communities what the best type of transportation solution is, how we can work together and coordinate collectively, because we do that very well in rural communities, working together, understanding that we have limited resources, so how do we make the most use out of them. And we'll do that by also looking at 3 particular study regions that we were asked to look at as part of this study, and that's Dufferin County, and I think there's a couple people here from Dufferin in the room, yes? 1 or 2. Wellington County, and finally Leeds and Grenville. So I'll go into our study purpose, and our study purpose was to illustrate the different types of coordinated transportation models that can be in place. And again, there's various different levels of coordination. You should see that in your handout today, and each one involves a different level of coordination or trust. And again, it's not a one-size-fits model. We were asked to outline some of the challenges and potential solutions. So as you're going through this process, you're going to be faced with a number of different hurdles. What are some potential solutions to overcome those hurdles? What are the opportunities as well? We were asked to develop a framework to identify and assess coordination opportunities. So you'll see that 6-step process that's in place that we've looked to develop to sort of generalize how do we go about doing it? And it is a long process, so it requires that commitment. And demonstrate that methodology on 3 study regions. So we've identified, we've gone through looking at who are the existing service providers that are in place, what are the gaps, what are the needs, and very preliminary, what are some potential opportunities or solutions that each of the study regions could look into. Because there's a lot of material to cover, we're going to focus on 2 study regions today, and that's going to be Wellington and Dufferin. So just quick background on the rural challenge. And again, we're all familiar with it, we all experience it. And it really comes down to, again, low densities, not a lot of people, and the need for long distance trips, which makes transportation very costly. Okay? We've also got limited budgets. There's a need, there's lots of different servicing opportunities that are in place in rural areas, so that limited budget is spread thin, and there's various different priorities. What this leads to is limited services in various different areas, and also disconnected systems where you have a number of different transportation providers, be it a community care agency or a health provider, that's stepped up to the plate and decided, well, we need to meet an individual mandate for our own members of the community. Maybe it's seniors, maybe it's youth at risk, maybe it's low-income employees trying to get to work. And they're focused on that mandate, and you've got several different disconnected systems, and leads to a number of different mobility gaps, because not everybody within the community gets their demands met within that sort of disconnected transportation framework. When we talk about rural transportation too, we also want to identify that the need is for not just one particular population segment. Often when people think about rural transportation, we think about the need for seniors and allowing aging at home and for persons with disabilities and providing them access to medical appointments. But rural transportation is more than that. It's about providing connectivity to youth and access to after-school activities and employment to keep them engaged within the community. It's about the low-income and unemployed and providing access to education, skills training, and new jobs, things that are very important. It's about families with one or fewer household vehicles that, again, you need to get around. It's about employers. And we've seen this in our 2 study regions where they require access to a qualified labor force, but and they're having difficulty finding that labor force because a certain segment of the population can't access that area of employment. So it's about many different things. So what is coordination? Coordination is a technique where 2 or more organizations interact jointly to accomplish their transportation objectives. So it's about finding that common mandate, common objective about improving rural transportation and working together to get there. It involves better resource management, in which improved organizational strategies are applied to achieve greater cost effectiveness in service delivery. It involves shared responsibility. It involves shared management and shared funding. And that all comes down to trust. Trust that the 2 or 3 or 4 organizations that are working together, that your individual mandates will continue to be met, and what you're doing by working together is not only meeting your own mandate, but improving that mandate, better meeting that mandate, and meeting that broader transportation mandate that you set as part of the coordinated framework. So what are some of the objectives of coordination? The first is to improve transportation system performance. So it's about increasing the cost effectiveness of service delivery. And you can do this by stretching scarce resources through the better resource management, by freeing local agency staff to do other work. So there may be a scheduler or a dispatcher that sort of potentially in a small agency that works sort of part-time on that role and part-time on another role that's important for the agency. So now if we sort of combine that role into a centralized function, you can free that staff to do other tasks that are important for the individual agency. It can reduce client confusion over who to call. If there's several different agencies providing services out there, you may not know as a resident of your community, okay, so which eligibility criteria do I fit? Who do I call to access transportation services? If there's a coordinated framework with potentially sort of one central phone number or website to call, it's easy to find transportation service and find out whether you're eligible. You don't have to call 5 or 6 different organizations to find out which organization you're eligible for. It reduces duplication of efforts and services, and increases the potential for shared rides. And in transit, that's really the key. There's a fixed cost in terms of the capital for the vehicle, the hourly rate of the driver, the fuel, maintenance of the vehicle, etc. And the more people that you can fit on that vehicle, the more cost effective the service is. So it's really about finding those opportunities to increase shared rides. And of course, once we have identified those improvements in the cost effectiveness of the service, what we're hoping to do is then reinvest it back into improving level of service. So when we've identified some of those mobility gaps, when we've improved the effectiveness of existing services, we can reinvest and fulfill some of those gaps in service. So what I'm going to do now is I'm going to take you through sort of what I call our 6-step process to establish a coordinated transportation framework. And what we've tried to do here is sort of logically put out the step-by-step process about what you would do within your community if you were looking to develop a coordinated transportation system. And it starts with, it's a very simple yet important steps. Find a friend. Find another organization that you think has a similar mandate that wants to improve rural transportation. So, there's lots of potential friends in this room, so I'm hoping by the end of this discussion that you'll add a new friend to your network that wants to improve rural transportation within your community. It goes on to identifying what's out there today, identifying the gaps and more importantly prioritizing them, because you can't solve all the world's problems in one day. So which ones do we want to solve first, tackle the low-hanging fruit and move forward, assess the different coordination models that are in place and the level of coordination that's comfortable and realistic for your individual community, go through how you're going to do it, and select a preferred coordination model. And of course, somewhere in there involves finding that secure, sustainable funding as well. So I'll go through each of the steps, and while I'm doing that, I'm going to relate it back to the two study regions that we've been working with in Wellington and Dufferin, and give you some preliminary results of what we found. So again, step one in the process is to identify 2 or more organizations that share a common goal of improving rural transportation. So again, a very important step in the process. You need to find committed partners in the process, people that again share that same mandate and structure, and begin by working together to develop a vision for success, including your goals and objectives. So what are you trying to achieve besides, you know, improving transportation? Sit down and make sure that you're all on the same page in terms of the outcome that you're looking to achieve. Always good to have a lead organization or a champion. That champion can change over time, but you really need someone you know, driving the bus on this campaign and moving forward with it. So again, very important. If you go into this partnership where the parties aren't committed to the process and committed to the outcome, it's not going to end up with any form of success. So that becomes imperative in moving forward. Develop a partnership commitment is always a good idea as well. A memorandum of understanding, something in writing that says, yeah, we're committed to this process. It's going to be a long process moving towards this. I know we worked with Easy Ride a number of years ago, and that was probably about 8 years in the making. Now that's probably a bit extreme. Things have advanced since, but you know, since the first time that a lot of the parties got to the table and said, you know, wouldn't it be better if we coordinated a little bit better, to starting with let's share some policies and procedures to where they are today. It took a while because of that trust factor. And you know, set up regularly scheduled meetings, at least monthly, and you know, until you sort of feel comfortable that you're gaining that momentum and moving forward with the process. So again, we looked at the 3 study regions, and our focus today will be on Wellington and Dufferin. And in terms of, you know, the people that came to the table, really want to thank the county in Wellington for their support with this project. They came to the table and said, yeah, we want you to look at our region when undertaking this study. And in Dufferin, it was Dufferin County Community Support Services and Headwaters that really drove the boat on this. So again, thank you to all 3 organizations. The second step is to identify existing transportation services and key stakeholders. So it's really important here to identify what's currently in place in your community, and there's going to be a lot that's going to surprise you in terms of the smaller different organizations that are providing some level of service within your community. So it doesn't just have to be the people that come to the table. It could be the local taxi industry. It could be a nursing home that has access to a vehicle but doesn't have a driver. It could be the school bus industry. There's lots of different resources out there in place, and it's very important right at the beginning to understand who's providing transportation services, and also who the stakeholders are. And for this, we looked at potential funding agencies such as municipalities, MTO, and the LINs, and also we looked at agencies that refer clients to transportation services because they have an interest in seeing that improved transportation service in place. So the way we went about doing it for our 3 study regions is we developed a sort of a standardized questionnaire that asks the right questions, and that will be highlighted in the report that comes out in early July. So to give you a sense of what type of questions you want to ask for people that provide transportation services, referral agencies, and potential funders. And we ask questions about, what type of service you're currently provided, number of vehicles, fares, etc. And everything to what's your interest in coordination? What are some of the needs that are in place within your community? What are some of the mobility gaps that you perceive? So both quantitative and qualitative are important questions to ask at this point. So again, when we look at Wellington County, we see a system where there's about 7 different community care agencies that are providing transportation services. About half of them are focused on seniors and persons with disabilities. We have 3 adjacent municipal transit systems, and again, an important part of the equation because we may be able to draw on those systems. There's Guelph, there's Waterloo, and there's Orangeville right here. We've got 2 nursing homes with vehicles, about 5 taxi companies with 18 licenses, 2 new accessible licenses that have just come on, school bus operators. So Wellington does not operate its own transit service today, but it does have a number of different transportation options that are available within the community. Within Dufferin, it was a bit of a different situation. We surveyed, and through our background review, we saw there's about 3 community care agencies that provide transportation services, mainly focused on seniors and persons with disabilities. So there isn't as many options available within Dufferin County as there is in Wellington, and again, the majority is focused on seniors and persons with disabilities. We do have 1 municipal transit system within the county, which is Orangeville. Private bus operators, day programs with vehicles, but no drivers, school bus operators, and taxi operators as well. So again, through the report, we'll identify who those transportation providers are within Dufferin that we've identified through our study. The third step, which is an important one, is to identify service demand gaps, implementation issues, and opportunities. So this really comes down to taking a look at the existing information that you've collected through your inventory and identifying what are those mobility gaps, who's not being served. Are there issues that we're going to come across when looking to develop a coordinated network? And that may have an influence on the type of coordinated network that you choose. Again, there's not one size fits all. And also, what are the opportunities that we have? And we also need to understand that. So again, what are the different service gaps that you'll be looking for when you're doing your analysis? You'll be looking at temporal availability. So you may have a service that's in place that operates from 9 to 5, but there's a major employer out there that has shift work, and they need service at 11 p.m. So although there's a service, their needs are not being adequately met. There's geographic availability. Maybe there's certain parts within your region or county that have good service and other parts that service is very limited. There's capacity issues, and I think that's a common one that we all face. Well, we have the service, but there's just not enough of it. We're constantly turning people down. We can't accommodate all their trip requests. And you can go on with eligibility. We have service, but it's focused on a certain population group. It's focused on a certain trip purpose, maybe medical trips, and sort of more social and recreational trips don't get accommodated. It's too expensive. Affordability is a big issue that we hear. And do we understand the service as well? So it may be in place, but no one knows about it. No one knows how to access it. So again, all different issues that you can assess within your region. So when we looked at Wellington, we needed to prioritize, what are some of the gaps that we heard through our study. And again, I'm hoping the friends get together within this group and go through this process on their own. They'll sort of further either confirm what we see here or identify other priorities, but it's an important part of the process. So what we identified in Wellington in terms of gaps was the primary one was in terms of trip purpose, that because there's capacity issues, there's not enough service, which is the second point. There's priority given to medical trips. So if you need to make a social trip or a work trip or a trip to school, those didn't fall on the priority list. There's also eligibility issues where a lot of the agencies that were in place were really focused on providing services for seniors and persons with disabilities. So again, if you're an adult or a youth, you may not have had appropriate access to transportation services. And geographic availability, what we found through our initial review, that a lot of the services concentrated in the center of Wellington, not as much service in the north of Wellington. So those were some of the primary gaps we discovered. When we looked at Dufferin, Capacity was the biggest issue. Again, the Dufferin County Community Sports Services is the main service provider focused on seniors and persons with disabilities outside of Orangeville Transit. So again, there wasn't, if a vehicle is making a medical trip to Toronto, and there's only I think there's about 4 vehicles in place, 4 or 5, and Patty, you'll forgive me if I quoted incorrectly. 4, okay, I was correct. Then that vehicle is tied up for the day, which leaves limited resources within Dufferin itself to accommodate any other local trips. So that capacity was a huge issue. And again, that then led to trip purpose, where the focus is now on medical trips, because that's the primary need that we're trying to fulfill, and some school trips or social trips are not fully being met, and eligibility, or if you're an adult or a youth, you may not have appropriate access to transportation, even though it's identified by many as a need. So it really comes down to a resource and a funding issue. When we look at continue on with step 3, the next thing we want to do is identify issues and opportunities. So service issues could be, challenges in servicing unique population groups. I know when we worked in Easy Ride, one of the issues with a coordinated framework when we were looking at a centralized dispatch function was that the Amish community, which was prevalent in, I believe it was the east side of Perth, was very used to calling a certain person and the local agency, and there was a lot of fear that they would not take you up on the service if it was sort of a 1-800 and a different voice than they were used to hearing. So again, overcoming some of those trust issues. There's privacy issues that are in place, ability to ensure stable and sustainable funding. If you're broadening your eligibility, will you jeopardize some of the existing funding that you have in place, particularly LIN funding? Differences in passenger fares and volunteer remuneration rates. Some agencies charge 40 cents a kilometer, some charge 45 or 50 cents a kilometer. So it makes it more challenging when coordinating trips. There are upfront costs, different service requirements, etc. There's also opportunities in place. You can build on local networks, an environment of trust and cooperation. If there's common database platforms, it makes it easier to coordinate as well, and there may be an ability to access new funding sources if you come together as a stronger voice instead of 5 or 6 different separate sort of localized voices. So that economy of scale and the ability to raise your voice as one unit. So when we looked at Wellington, in terms of implementation issues, mandate and funding constraints was a large one. There's a mandate to service seniors and persons with disabilities was tied to funding received from the LIN. Funding levels, sustainable funding is an issue for a number of the existing providers that was mentioned, and driver availability. So we had vehicles, but with vehicles, it's really important to have a driver. It just kind of defeats the purpose if you don't have it. So that became an issue. So I know with a number of people received the aging and home vans. Well, great, we have the van, but now what? What do we do with it? So it becomes a great advertising billboard potentially if you can't find the driver. But you need that resource to move forward with it. In terms of opportunities, we've identified that there was already an existing sort of culture of coordination that was taking place within Wellington. With the Wellington Transportation Services, it's a 1-800 number where you can sort of a central referral point a number of different agencies belong to, that they would refer customers to the most appropriate agency to provide the trip. So that was a great resources are currently placed, and they would in many cases deliver each other's trips as well where they couldn't accommodate. There was some municipal support, again through this study that became evident, and a number of the local municipalities came through and said transportation is important to us. There's Guelph Transit that's within the center of Wellington, and they currently have a very robust and scheduling dispatch software program in place. So is their ability to work with Guelph, work with an existing service provider that has lots of experience and better utilize that resource. There's some private operators that are currently providing service. Can we utilize them? And there's an opportunity to access provincial gas tax funding, which Wellington currently doesn't access. When we look at Dufferin, The main issue that we found was that there's just limited transportation service providers in place. Resources became one of the more significant issues that we found in Dufferin. And as a result, everything was stretched. Everything was operating fairly effectively and very, very stretched. Mandates and funding constraints, again, with a lot of the funding tied to LIN and aging at home, and thus focused to seniors and persons with disability. And of course, we get back to the resource and driver availability as well, and I think that's probably a common thing that a lot of organizations and agencies face that provide transportation in rural communities. What are some of the opportunities that we discovered? Well, one, we discovered through our stakeholder workshop that there's going to be potentially a new service that's piloted between Shelburne and Orangeville. It's a corridor service that's going to be provided to get commuters from Shelburne to Orangeville to access the GO bus. So again, that's the first sort of corridor service that we've got in place in Dufferin. It's an opportunity. Can we build on that in the future? Let's monitor the success of it, see how it goes. Maybe there's a potential to build on that to accommodate other trip needs. There's a new resources. I know Dufferin County Community Services recently purchased an 8-seat van, and they're using it for charter services. Can we continue to build on that additional resource? There are a number of agencies out there that currently have a van but with no driver. So can we capitalize on that van? Can we find a way through a coordinated network to capitalize on that resource? And again, Dufferin County does not have any provincial gas tax funding, so there's an opportunity to take advantage of that. Now I'm going to go through steps 4 through 6 and then go through after that how they relate to Dufferin and Wellington. So step 4 is to assess the different coordination models. And here the recommendation is to hold an evaluation session with representatives from each organization to discuss and evaluate the level of coordination that's desired. And within this, the real struggle is, or the real challenge is building that trust, outlining the level of independence versus sort of coordination that each agency or organization is willing to take on. And if you think about it, you know, many organizations' mandate is to broadly improve quality of life for their clientele, for their residents and whatever. Transportation becomes a means of doing that. And so the important message here is, if you go to one of the higher levels of coordination and we take away some of your control with transportation, it doesn't mean you're not still meeting your quality of life mandates that you're trying to achieve. Transportation, again, just becomes a component of how you do that. So we've got 4 models that we considered, that we sort of broadly identified. Model 1 has the highest level of coordination, and Model 4 has the lowest level of coordination. But again, it's important to note that it's not a grading system with, you know, this is the A model and then this is the F model. There's no one right solution for each community, and you really need to understand your local politics, the local resources in place to understand which model works best for you. So we'll go through Model 1, and that's a centralized control model. And this is where one lead organization plans and operates all transportation services on behalf of the partnership. So if there were several agencies that provided service, they may have gave up control of their vehicles. Instead of funding their own operating staff to provide services, they may put some of that funding into the partnership. So it's identifying that lead agency or lead organization that takes control. And this is the highest level of coordination. This is where the central agency has access to sort of all the vehicles in place, drivers, etc., and can really make cost-effective decisions based on the ability to meet the needs of the community and not restrict it to the constraints of each individual organization or agency. But of course, you know, this requires a certain degree of trust to move into, to ensure that the individual local agencies continue to have their mandates met. And a way to do this is to form a steering committee in which each of the partners within this centralized control model form part of the decision-making process to make those broader strategic level decisions and let the lead agency make the day-to-day operational decisions. The second model, or the second and third model, is what I call a brokerage model, and there's two types of this. And the brokerage model is where you still have one lead agency that plans and schedules transportation services and trips, but partner organizations retain ownership of their vehicles and resources. And so what happens here is in Model 2, where it's centralized coordination, the lead agency will have the ability, potentially through a scheduling dispatch software program, to book the appropriate trips that are necessary and identify what the most appropriate vehicle to accommodate that trip should be. Whether it's part of Agency A, Agency B, or Agency C, it doesn't matter. We're looking to book the most cost-effective trip possible to reduce duplication and to increase the number of passengers in your vehicle. That's communicated to the individual agency, who then delivers the trip, and the cost of that trip is exchanged based on an agreed-to rate per trip. So again, it's making the most effective use. In Model 3, very similar. The big difference is it's a permission or confirmation based. So if Agency A wants to book a trip for Agency B, needs to call them up first and say, okay, do I have your confirmation or permission to book this trip? Okay, that trip is booked, and it continues on. So it's just that level of trust being established. And many times between these two models, it usually starts off at Model 3 and then transitions to Model 2 as trust continues to be developed, and that was the case, I know, in Easy Ride. Model 4 is voluntary cooperation, and in this model, all partner organizations retain ownership of vehicles and services, but work together to improve policies and processes. So this could be back-end delivery of policies and process. How do we train our drivers? You know, is there one organization that can train all drivers? How do we improve our policies and procedures? How do we respond to certain legislative requirements? Or it could be putting together a 1-800 number or a central website that allows people to understand all the transportation services that are in place and provides that information to your customer, to your client, to your resident. So once we've looked at the 4 different models and assessed what level of coordination is right for us, and we may select 1 or 2 models that we want to move through, our next step is to identify the different applications of providing transportation that should be coordinated. So when you're looking at transportation services, there's various different components to delivery. And I've got a lot. I'm going to have to speed up a little bit. There's service planning, customer service, marketing awareness, intake, scheduling and dispatch, etc. These are all different components of transportation service. And so certain ones are required under the model, other ones are optional, other ones are not applicable. So in our report, we go through an assessment process that identifies how we go about understanding which elements of transportation service are right for a coordinated framework. Again, this is just an example of the assessment methodology. Finally, in step 6, this is where we select a preferred model, and we need to confirm the mission statement and vision, develop the service plan and how coordinated structure will be organized and implemented, approach funding partners to secure funding, and develop an action plan for implementation, and a monitoring plan to monitor results, and of course report back to the funding agencies. Part of this is always to secure appropriate funding, and we'll get into this in a little bit more detail, but there's lots of areas of secure funding, from provincial gas tax, from federal gas tax, LIN funding, grants, donations, in-kind services, passenger fares, lots of different funding that you can sort of piece together to run an effective system. So I'm going to go through quickly some of the preliminary thoughts that we had for both Wellington and Dufferin. When we looked at Wellington, we looked at moving towards Model 3 or Model 2, which is a brokerage type model. We felt this was very applicable in the situation because of the number of different service providers that were in place and the various different mandates that they each had. So by working together, we felt this was an appropriate way forward. We developed a number of preliminary recommendations. The beginning was to form a partnership, begin that collaboration on policies and procedures and information sharing, to pursue sustainable funding to grow, so approaching the county or one of the local municipalities to receive some provincial gas tax funding and how to get involved in that. We thought it was very important as well to develop that centralized scheduling and dispatch office and develop a centralized brand and communications plan. So, you know, one sort of transportation source, Wellington Transportation Group, or, you know, think of a better name, I'm not in marketing, but, you know, something that's catchy that says, you know, this is the place where we go to access transportation services. And through that centralized scheduling and dispatch office, allow the ability to better coordinate trips, particularly demand responsive trips. We also looked at the ability to identify some corridor services that may help funnel some of that demand into more cost-effective service delivery. So right now there's a student shuttle that goes from Fergus-Elora to Guelph that accommodates students to the University of Guelph. And is there ability to feed into that corridor for some of the demand responsive services for passengers that are ambulatory and don't require that sort of one-on-one level of care? What that does is it frees up the demand responsive service to make trips outside of that Fergus-Elora Guelph corridor and allows them to fill more priority needs. The other area we looked at was to explore the formation of employee shuttles. Through our consultation, what we identified is, particularly in the north, there's a number of major employers that are having challenges in accessing employment or employees because many employees don't have access to private vehicles. So is there an opportunity to create a shuttle through this partnership? So one of the things we looked at was there's a demand for employees to come from Waterloo to the town of Minto to access employment. So could you use one of the existing vans that are operated by the community care agency to provide that 7 a.m. run, and that van is likely not being used too often at 7 a.m. And then that van then converts to a community shuttle within the local neighborhood to provide access to local trips. So you can combine those resources to accommodate different trip purposes. Is there also the ability to combine it with the corridor service between Guelph and Fergus? So employees can begin their trip in Fergus to access the employee shuttle instead of into Guelph. The other thing we looked at is the identification of purpose-specific services or shuttles, and this is something that we've also identified in Dufferin County, so I'm just going to talk about both in the same context. The ability to manage demand, we thought was very important, is, you know, especially for the discretionary trips. So if you can design a shuttle that takes people from one community, let's say it's Shelburne or within Minto to the No Frills or a certain grocery store, and focus it in on a Tuesday, it helps manage that demand, and maybe that gets done for a reduced fare, because now what we're doing is we're grouping people together on the same shuttle. The benefit of that also is for the demand responsive services that are in place for seniors or for people that need more of that one-on-one care and attention, it saves that resource because the two trip purposes are no longer competing with each other. You're trying to funnel various different trip purposes on one particular day to one particular purpose. So it could be a Tuesday No Frills run, a Wednesday Stone Road Mall run, a Thursday Orangeville Mall run, etc. Finally, we looked at identifying new partners, working with the taxi industry potentially to provide services, and looking at partnerships with adjacent transit providers such as Guelph Transit that currently has a scheduling dispatch software program in place. So there may be opportunities to better utilize that resource and save on the overall capital cost of purchasing those expensive programs. Go over Dufferin County really quickly and some of the recommendations, and again, I'm around afterwards if you want to chat in a little bit more detail. Well, with Dufferin, we found one of the challenges was it wasn't as much of a coordination issue, it was a bit more of a resource issue. There wasn't a lot of resources out there. There weren't a lot of different agencies to coordinate with. So one of the things we found was one of the first steps is to identify other sustainable funding sources to improve the level of transportation service that's in place. So we looked at starting with a voluntary cooperation model, and identifying ways with the existing agencies and organizations that are together to work together and moving on to a brokerage, some sort of brokerage model. So in terms of the recommendations, begin with forming a partnership and collaborating on policies and procedures, pursuing the sustainable funding similar to Wellington, expanding on the centralized information sharing. So Headwaters Communities in Action already has developed that database in place. Is there an opportunity to continue to expand on the good marketing work that's done to try to get everybody informed of what the options are within Dufferin County? Explore potential, and even explore the potential of a 1-800 number where people can call in and get referred to the appropriate agency. Again, we looked at that purpose-specific shuttle with that new van that's in place. So really capitalizing on that new van and focusing that resource. So I won't get into that in any more detail. We also looked at the potential of building on the new service, or that new pilot service that's going to be coming in place between Shelburne and Orangeville. And right now the focus is on commuters, but by working together and understanding the existing travel demands, we can look within our own database of existing origins and destinations or travel behavior and identify, how many trips are the demand responsive agencies making between Orangeville and Shelburne, in the middle of the day, and is there ability to accommodate another shuttle? Is there ability to feed into that service? So especially for the ambulatory passengers that don't require that day-to-day care, to save that resource for another type of trip that needs to be made. With funding, we also looked at opportunities to use the existing resources such as the early years van. So again, if sustainable funding comes in place, is there an opportunity to hire a part-time driver to operate that existing the van in place? The benefit for Early Years Center is it saves the program coordinator and allows them to do what they should be doing, which is coordinating programs instead of driving. And if you establish some sort of agreement where with that van, priority is placed on program participants to early years, you can better utilize that van for during periods when it's not being used for delivery of clients to the early years program. So I want to end with some final thoughts, and apologize, Norm, I think that was a little bit more than 3 minutes, but I tried to go through it as quickly as I could. Final thoughts is, we've all identified the need for improved rural transportation. There are several members of our communities that don't have access to private automobiles, either through age, they can't drive anymore, through income, and some by choice as well. And you really need that access to employment, services, medical, school, to enhance the quality of life in your rural communities and to ensure that your rural communities continue to grow, thrive, and prosper. So we've identified a couple of issues here today, one being a resource challenge. And of course, sustainable funding will always be part of the equation. It's always going to be something that we look for to improve rural transportation. And of course, it's never going to be enough. There's always going to be a need to continue to improve and enhance. So what we've tried to demonstrate here today is the opportunity for coordination. By working together, and which is what we do very well in rural communities, to accomplish a shared mandate, to better stretch the resources that you have in place to accomplish that shared mandated objective of improving transportation in our rural regions. Thank you very much.